The morning light filtered through the blinds of Dr. Richard Keller's office at Pine Ridge Memorial Hospital. He straightened his tie, glancing at the framed medical degrees that lined his wall. 20 years of surgical practice had earned him respect, power, and the corner office with the best view of the city. His phone buzzed with a message from the hospital director. Someone from the FBI needed to speak with him. Dr. Keller frowned. The FBI? His mind raced through possibilities. Insurance fraud investigations, prescription irregularities, or perhaps something to do with that pharmaceutical company whose board he sat on. Nothing serious, he assured himself. Nothing that would tarnish his spotless reputation. A knock on his door interrupted his thoughts. His assistant poked her head in. "Dr. Keller, the FBI detective is here to see you." He nodded, straightening the papers on his desk. "Send them in." The door swung open and Dr. Keller looked up, the practiced smile freezing on his face. The man who entered wore a crisp, dark suit, but it wasn't the badge or the serious expression that caused the doctor's smile to falter. It was the color of the detective's skin. Detective Andre Wilson stood in the doorway, taking in the room with a quick professional glance. He'd been doing this long enough to recognize the subtle shift in the doctor's expression, the slight tightening around the eyes, the almost imperceptible straightening of the spine, the millisecond of hesitation before extending a hand. "Dr. Keller, I'm Detective Wilson with the FBI." His voice was deep and measured. "Thank you for making time to see me today." The doctor stood and shook the detective's hand, his grip firmer than necessary. "Of course. Though I must admit I'm curious about what brings the FBI to my office. I run a tight ship here." Detective Wilson nodded, not rushing to explain. He took the seat across from the doctor only after being invited to sit. He placed a thin folder on the desk between them. "We're investigating some unusual patterns in patient outcomes at several hospitals in the region," the detective explained, watching the doctor carefully. "Pine Ridge Memorial is one of the hospitals we're looking at." Dr. Keller leaned back in his leather chair, a small laugh escaping his lips. "Patient outcomes? I assure you, Detective, my surgical record speaks for itself. Perhaps you should be looking at some of our newer staff. The residency program isn't what it used to be." The detective didn't smile back. "Actually, Dr. Keller, it's your surgical record that prompted our visit." The temperature in the room seemed to drop. Dr. Keller's face hardened as he processed the detective's words. "I don't understand," he said, his voice losing its friendly tone. "My record is exemplary." Detective Wilson opened the folder, revealing charts and statistics. "Overall, yes. Your success rates for most demographics are indeed impressive. However, when we break down the data by patient background, we notice some discrepancies." The doctor's eyes narrowed as he looked at the papers. "What exactly are you implying, Detective?" "I'm not implying anything yet. I'm here to gather information." The detective pulled out a specific chart. "Can you explain why mortality rates for your minority patients are 16% higher than for your white patients, even when controlling for all other factors?" Dr. Keller's face flushed. "That's absurd. Medicine doesn't see color. I treat all my patients with the same level of care." "The statistics suggest otherwise," Detective Wilson said quietly. He slid another document across the desk. "We've also noticed differences in pain medication prescribed, follow-up care recommended, and referrals to specialists." The doctor stood abruptly, walking to the window. Outside, people moved through the hospital parking lot. Staff, patients, visitors, all going about their day, unaware of the tension building in his office. "Statistics can be manipulated to tell any story you want," Dr. Keller said without turning around. "Perhaps these minority patients had more underlying health issues. Perhaps they didn't follow my instructions properly. Perhaps their family medical histories weren't as thoroughly documented." Detective Wilson remained seated, his voice calm. "We've accounted for all those variables, Doctor." "The pattern remains." Dr. Keller turned, his face a mask of professional concern. "Well, then your methodology must be flawed. I've dedicated my life to saving people, all people." The detective nodded, neither agreeing nor disagreeing. "I'll need to interview your staff and review some of your case files. You'll need warrants for that," the doctor said quickly. "Already have them." Detective Wilson produced the legal documents from his jacket pocket. "The hospital director has been informed. I'll be here for the next few weeks." Dr. Keller's jaw tightened. Weeks? This is outrageous. Do you have any idea how busy this surgical department is? How many lives depend on our work here? I do, the detective said, standing now. That's precisely why I'm here. The two men stared at each other across the desk. The air between them charged with unspoken tension. Dr. Keller saw not the badge or the professionalism or the intelligence in the detective's eyes, but only the threat to everything he'd built. Detective Wilson saw not just another resistant subject of an investigation, but the subtle tells of a man confronting something he'd kept hidden, perhaps even from himself. The silence was broken by the doctor's phone. He glanced down at it, then back at the detective. I have surgery scheduled in an hour. I need to prepare. Detective Wilson gathered his documents. Of course. I wouldn't want to interfere with patient care, but I'll be speaking with your surgical team afterward. They're very busy people, Dr. Keller said, his voice clipped. So am I. The detective handed him a card. If you think of anything that might help explain these patterns, you can reach me at this number. Dr. Keller took the card between two fingers, as if it might contaminate him. There's nothing to explain, detective, but I'll cooperate fully. I have nothing to hide. As Detective Wilson turned to leave, Dr. Keller called after him. Just out of curiosity, why did they send you specifically for this case? The detective paused at the door. I specialize in healthcare fraud and discrimination cases. I've been doing this for 12 years. That's not what I meant, the doctor said, the words out before he could stop them. Detective Wilson turned back, his expression unchanged. I know exactly what you meant, Dr. Keller. I'll see you tomorrow. After the detective left, Dr. Keller sank back into his chair, loosening his tie. His hand trembled slightly as he reached for his phone to call the hospital's legal team. Outside his window, the detective crossed the parking lot to his car, already making notes on his phone about the interview. Both men knew this was just the beginning. The carefully constructed walls of Dr. Keller's world had just developed their first crack, and Detective Wilson was determined to find what lay behind them. Neither man could predict how this investigation would change them both, breaking down barriers neither knew they had built. In the surgical prep room an hour later, Dr. Keller scrubbed his hands with more force than necessary, trying to focus on the procedure ahead, and not on the FBI detective who was now speaking with the hospital director. The water ran hot over his knuckles as he replayed the conversation in his mind, wondering if he'd said too much, revealed too much. Everything okay, Dr. Keller? A nurse looked at him with concern. You've been scrubbing for almost 5 minutes. He turned off the water with his elbow, forcing a smile. Just being thorough. Who's our patient today? The nurse handed him the chart. Dr. Keller's eyes went immediately to the patient's last name and the box indicating race. For the first time in his career, he found himself consciously aware of noticing this information, and the realization made him uncomfortable. Is there a problem with the patient? The nurse asked, noticing his hesitation. Dr. Keller shook his head. No problem at all. He handed back the chart and allowed the nurse to help him with his surgical gown and gloves. As he prepared to enter the operating room, he glimpsed Detective Wilson through a window in the corridor, talking to one of the hospital administrators. Their eyes met briefly across the distance. The detective nodded slightly, a gesture that clearly said, I'll be watching. Dr. Keller turned away and pushed through the doors into the operating theater, trying to focus only on the surgery ahead and not on the sense that everything he'd worked for was suddenly balanced on a knife's edge. 3 days into the investigation, Detective Wilson had set up a small temporary office in an unused consultation room down the hall from Dr. Keller's suite. The walls were covered with charts and patient files, carefully organized by date and outcome. The detective stood before them, hands in his pockets, looking for patterns that the numbers alone couldn't reveal. A knock at the door pulled his attention away from the wall. One of the nurses, Nurse Chen, stood in the doorway with a stack of files. These are the pre-op assessments you asked for, she said, placing them on the desk. She lingered, glancing at the door before speaking again. There's something else you should know. Detective Wilson motioned to a chair. Please sit, she shook her head. I can't stay long. Dr. Keller has eyes everywhere. She lowered her voice. He held a staff meeting yesterday. Told us the FBI was on a fishing expedition and that we should be careful about what we say to you. The detective's expression remained neutral, but he made a mental note. Did he suggest what you should or shouldn't tell me? Not directly. He's too smart for that. She glanced at the door again, but he made it clear that loyalty to the hospital was important, and that this investigation could damage everyone's reputation. "Thank you for telling me this," Detective Wilson said. "If you remember anything specific, please let me know." After she left, the detective added a note to his growing file. Dr. Keller was now actively interfering with the investigation, not enough to bring obstruction charges, but enough to show he was worried. Later that morning, Detective Wilson knocked on Dr. Keller's office door. The doctor was reviewing charts, his reading glasses perched on the end of his nose. "Detective," he said without looking up, "I'm rather busy today." "I'll be brief." Detective Wilson took a seat without waiting for an invitation. "I'd like to discuss Mr. Raj Patel's case from last April." Dr. Keller finally looked up, his face carefully composed. "Patel, refresh my memory. 56-year-old man came in with chest pains. You diagnosed heartburn, prescribed antacids, and sent him home. He died of a heart attack 12 hours later." The doctor removed his glasses.
Yes.
"Unfortunate case. His symptoms were consistent with acid reflux. According to the notes from the ER nurse, he also had shortness of breath, radiating pain down his left arm, and a family history of heart disease." The detective placed a copy of the nurse's notes on the desk. Standard protocol would have been to run an EKG and keep him for observation. Dr. Keller's jaw tightened. "Medicine isn't just about following protocols, detective. It requires judgment." Mr. Patel was overweight, complained about spicy food triggering his symptoms, and seemed anxious about missing work. The clinical picture suggested gastric issues. "And did the fact that he spoke with an accent affect your judgment?" The question hung in the air between them. The doctor's face flushed. "That's absurd and offensive. 2 weeks before Mr. Patel, you admitted a Mr. Gregory Thompson with nearly identical symptoms. White male, similar age. He received an EKG, cardiac enzymes, and overnight observation. The cases were different," Dr. Keller insisted, standing up. "You're cherry-picking examples to fit your narrative." "I have 8 more cases just like this," Detective Wilson said, his voice level. "Different patients, similar patterns." "This is ridiculous," the doctor paced behind his desk. "You're not a medical professional. You can't possibly understand the nuances of diagnostic decision-making. That's why I've consulted with 3 independent physicians who reviewed these cases blindly. They all questioned your decisions in these specific instances." Dr. Keller stopped pacing. "Who authorized that?" "Those patient files are confidential. The warrant did. And the hospital ethics board signed off on it." Detective Wilson leaned forward. "Dr. Keller, I'm not here to ruin your career. I'm here to understand why these patterns exist and to make sure all patients receive equal care." "Equal care," the doctor repeated with a subtle edge to his voice. "Is that what this is really about? Or is it about meeting some diversity quota? Making sure every demographic gets the same outcome regardless of biology, lifestyle, or compliance?" The detective watched him carefully. "Do you believe there are biological differences between races that affect medical outcomes, Dr. Keller?" The doctor hesitated, realizing he was on dangerous ground. "I believe in science, detective. And science shows that certain populations have higher risks for certain conditions." "And do you believe those differences justify different standards of care?" "I believe in treating each patient as an individual," Dr. Keller said, his professional mask firmly back in place. "Now, if you'll excuse me, I have patients waiting." Detective Wilson stood but made no move to leave. "One more thing. I understand you called a staff meeting yesterday to discuss this investigation." The doctor froze momentarily. "I simply informed my team about the investigation, as is my right and responsibility as department head." "Did you also suggest they be careful about what they say to me?" Dr. Keller smiled thinly. "I suggested they be accurate and truthful, as I'm sure you would want them to be." "Interfering with a federal investigation is a serious offense, Doctor. Is that a threat, Detective?" "Just a reminder." Detective Wilson moved toward the door. "I'll be interviewing your surgical team this afternoon. They're prepping for a complex procedure right now," Dr. Keller said quickly. "Perhaps tomorrow would be better." The detective paused. "What procedure?" "Aortic valve replacement. Elderly patient, high risk." Detective Wilson checked his notes. "That's not on the surgical schedule I received this morning." The 2 men stared at each other, the tension palpable. "It was added late," Dr. Keller said, breaking the silence. Emergency case, I see. What's the patient's name? I'll add it to my records. The doctor hesitated just a fraction too long. Harrison. Thomas Harrison. Detective Wilson made a note. I'll check in on Mr. Harrison later. Good day, doctor. As soon as the detective left, Dr. Keller grabbed his phone and made a call. We have a problem, he said in a low voice. The FBI agent is digging deeper than we expected. He knows about Patel. In the hallway, Detective Wilson paused by the nursing station. Excuse me, he said to the charge nurse. Could you tell me which operating room is being used for Mr. Harrison's valve replacement today? The nurse looked confused. Harrison? We don't have a valve replacement scheduled today. That's what I thought. Thank you. The detective walked down to his temporary office, adding Dr. Keller's lie to his growing file. The doctor was getting nervous, making mistakes. The question was why? What was he so desperate to hide? Later that afternoon, Detective Wilson sat across from Dr. Bryant, the hospital's chief of medicine. The older man looked troubled as he reviewed the detective's findings. These are serious allegations, Dr. Bryant said, removing his glasses. Dr. Keller has been with us for 20 years. His overall record is excellent. For some patients, the detective corrected gently. Not for all, Dr. Bryant sighed. What exactly are you looking for here, detective? What outcome do you want? The truth. And a hospital where every patient receives the best possible care, regardless of their background. The chief of medicine nodded slowly. Noble goals. But medicine is complicated. Outcomes depend on so many factors, I understand that. But when those outcomes consistently vary along racial lines under one specific doctor, we need to ask why. Dr. Bryant leaned back in his chair. 20 years ago when Richard Keller joined our staff, things were different. The medical establishment was less aware of certain biases. The training was different. Are you saying bias was built into his medical education? I'm saying we all carry the marks of our training, detective. And some of us were trained in an era when cultural competence wasn't emphasized. He paused. That doesn't excuse poor medical decisions, but it might help explain them. Detective Wilson considered this. Has Dr. Keller ever participated in the hospital's diversity training programs? Dr. Bryant's expression said it all. He's always found a reason to be unavailable. Surgeries scheduled, conferences to attend. After a while, we stopped pushing. As the detective left the chief of medicine's office, he spotted Dr. Keller at the end of the hallway, deep in conversation with one of the surgical residents. The young doctor looked uncomfortable, nodding repeatedly as Dr. Keller spoke in hushed tones, occasionally glancing over his shoulder. Detective Wilson changed direction, walking toward them. Dr. Keller saw him coming and immediately straightened, his expression shifting from intense to casual in an instant. Detective, he said with forced lightness, just discussing a complex case with Dr. Lee here. The young resident looked like he wanted to be anywhere else. I should check on my patients, he mumbled, quickly walking away. Dr. Keller and Detective Wilson stood alone in the hallway, surrounded by the bustle of hospital staff moving around them. For a moment, neither spoke, each taking the measure of the other. Your investigation is disrupting this hospital, Dr. Keller finally said. People can't do their jobs properly with you hovering over them, questioning their every decision. I'm only questioning the decisions that need questioning. Doctor? The detective's voice remained calm, and I'll continue until I understand exactly what's happening here. Dr. Keller stepped closer, lowering his voice. You think you understand what you're seeing, but you don't. You're connecting dots that aren't there. Then help me understand. Explain the patterns in your patient care. The doctor's face hardened. There are no patterns, only coincidences being twisted to fit your agenda. As he walked away, Detective Wilson called after him. We'll be reviewing all your cases from the past 5 years. Dr. Keller, every single one. The doctor paused mid-stride but didn't turn around. His shoulders tensed visibly before he continued walking, disappearing around the corner. Detective Wilson watched him go, more convinced than ever that Dr. Richard Keller was hiding something. And he was determined to find out what it was, no matter how deep he had to dig. The hospital cafeteria buzzed with afternoon activity as Detective Wilson sat alone at a corner table, reviewing notes on his tablet. He'd been at Pine Ridge Memorial for a week now, and the walls of resistance around Dr. Keller were starting to show cracks. Staff members who had initially avoided eye contact were now approaching him with stories, some dating back years. His phone vibrated with a message from his supervisor. Update needed. Progress. The detective typed a quick response about the growing evidence against Dr. Keller, but admitted they still lacked a smoking gun, something that would definitively prove the doctor knowingly provided substandard care based on race. Commotion near the cafeteria entrance caught his attention. Hospital staff rushed toward the doors, several speaking urgently into phones. Detective Wilson stood, instinctively moving toward the activity rather than away from it. "What's happening?" he asked a passing nurse. "Multiple trauma victims coming in," she replied without slowing. "Bus accident on the highway." The detective followed the flow of medical personnel toward the emergency department. The organized chaos of a hospital in crisis mode unfolded before him. Doctors barking orders, nurses preparing treatment rooms, orderlies clearing hallways for incoming gurneys. In the center of it all stood Dr. Keller, calm amid the storm, assigning staff to treatment areas with the confidence of someone who had handled countless emergencies before. "Lopez, you take Bay 1. Chen, Bay 2. Richardson, you're with me in Trauma 3 when they arrive." He looked up and noticed Detective Wilson observing. Something flickered across the doctor's face. Annoyance, perhaps, before he returned to his preparations. The emergency room doors burst open as ambulances arrived. Paramedics rushed in with the first victims on stretchers, calling out vital signs and injuries as they moved. Detective Wilson stepped back against the wall, out of the way but still watching. Dr. Keller moved to the first stretcher, quickly assessing the elderly white woman with head and chest injuries. "Get her to Trauma 1, he ordered, then moved to the next patient, a middle-aged Asian man with a broken leg. The third stretcher carried a young black man, unconscious with blood soaking through bandages on his abdomen. "Trauma 3, Dr. Keller said after a quick assessment. Already moving to the next patient, Detective Wilson watched as the patients were wheeled to their assigned areas. He noticed Dr. Keller followed the elderly white woman to Trauma 1, taking personal charge of her care despite having assigned himself to Trauma 3. A young resident looked confused, glancing between Trauma 3 and Dr. Keller's retreating back. "Dr. Keller? What about Trauma 3? "Handle it, Dr. Park," Keller called over his shoulder. "Looks like a simple penetrating wound. You've seen those before." The resident hesitated only briefly before rushing to Trauma 3. Detective Wilson followed, staying back but close enough to observe. The young doctor removed the bandages, revealing a large piece of metal embedded in the patient's side. His face paled. "I need help with this," he said to a nearby nurse who was already calling for assistance. The detective stepped forward. "Is there a problem?" The resident looked up, startled. "This isn't a simple wound. There's a metal fragment near what could be the liver or spleen. He needs an experienced surgeon." Detective Wilson looked back toward Trauma 1, where Dr. Keller was fully engaged with the elderly patient. A decision formed in his mind. "I'll get Dr. Keller," he said, moving quickly across the emergency department. He pushed through the door to Trauma 1. "Dr. Keller, you're needed in Trauma 3. The patient has a complex penetrating wound that Dr. Park can't handle alone." The doctor barely glanced up. "I'm in the middle of a critical case. Dr. Bryant can assist if needed." "Dr. Bryant is in surgery," the detective said. "And from what I saw, this patient could die without experienced help." Dr. Keller's hands paused over his patient. "This woman could also die without proper care. She has 3 other doctors attending her," Detective Wilson pointed out. "The young man in Trauma 3 has 1 inexperienced resident." The doctor finally looked up, his eyes cold. "Are you practicing medicine now, Detective?" "I'm observing patterns, Doctor. That's my job." Something in the detective's tone made Dr. Keller glance around the room. Several nurses and a resident were watching the exchange, expressions unreadable. The doctor seemed to make a calculation in his head. "Fine," he said tightly. "Dr. Reynolds, take over here. Keep me updated." He snapped off his gloves and followed Detective Wilson to Trauma 3. When they entered, the scene was tense. The patient's blood pressure was dropping, and Dr. Park looked overwhelmed as he tried to stabilize the wound without removing the metal fragment. Dr. Keller took in the situation with a professional eye. "Move aside," he told the resident, taking his place. His hands moved with practiced efficiency as he examined the wound. "We need to get him to an OR now. This fragment is probably pressing against his portal vein. 1 wrong move and he'll bleed out." The team mobilized quickly, preparing the patient for emergency surgery. Detective Wilson watched Dr. Keller work, noting the shift in his demeanor. The doctor was now fully engaged, focused solely on saving the patient regardless of who he was. "Are you coming to observe the surgery too, Detective?" Dr. Keller asked as they wheeled the patient toward the elevator. "If you don't mind." The doctor shrugged. "Suit yourself, but stay out of the way." In the operating room, Detective Wilson stood in the corner, watching as Dr. Keller and his team worked to remove the metal fragment and repair the damaged blood vessels. The procedure was delicate, requiring precision and experience that the young resident clearly lacked. "Suction there," Dr. Keller ordered. "More light. I need to see exactly where this fragment ends." His hands moved with confidence, navigating the complex anatomy with practiced ease. 2 hours later, the metal fragment lay in a surgical pan, and Dr. Keller was closing the final incisions. The patient's vital signs had stabilized, his life no longer in immediate danger. As they scrubbed out afterward, the doctor glanced at Detective Wilson. "Satisfied? Did I pass your little test?" "This wasn't a test, doctor. It was an observation." "And what did you observe?" "That I'm fully capable of saving any patient who comes through those doors. That when you focus on medicine instead of who's on your table, you're an excellent surgeon." The detective dried his hands. "Which makes me wonder why that focus sometimes slips." Dr. Keller's jaw tightened. "You're still pushing that narrative." "It's not a narrative. It's data. And what I just saw supports it." The detective leaned against the sink. "You initially assigned yourself to trauma 3, then changed your mind when you saw the patients. You took the elderly white woman's case and passed the young black man to an inexperienced resident, calling it a simple wound when it was anything but." "That's not what happened," the doctor insisted. "I made quick triage decisions based on visual assessments. And yet, when you actually examined the young man's wound, you immediately recognized its severity." Dr. Keller threw his paper towel in the trash with more force than necessary. "You're twisting this to fit your investigation." "I'm observing patterns," the detective repeated. "And today's pattern matches everything else I've seen in your practice." Before Dr. Keller could respond, a nurse pushed open the door. "Doctor, the patient from Trauma 1 is crashing. They need you in ICU immediately." The doctor rushed out without another word, leaving Detective Wilson alone in the scrub room. The detective made notes on his phone, documenting what he'd just witnessed. The emergency had provided an unplanned but revealing window into Dr. Keller's instinctive decision-making choices, made in the heat of the moment before he had time to consider how they might look later that evening. As the emergency department settled back into its normal rhythm, Detective Wilson sat in his temporary office updating his case files. A knock at the door interrupted his work. It was Dr. Park, the young resident from Trauma 3. "Can I talk to you?" he asked, glancing nervously down the hallway. "Of course. Come in." The resident closed the door behind him. "That patient today, the one with the metal fragment. If you hadn't intervened—" He paused, gathering his courage. "I wasn't qualified to handle that case. I would have made mistakes, possibly fatal ones." The detective nodded. "I know. This isn't the first time," Dr. Park continued. "Dr. Keller has a pattern of assigning less experienced staff to certain patients. I didn't see it at first, but after today," he shook his head, "I can't ignore it anymore." "Has he ever explicitly said why he makes these assignments?" "No, nothing direct. But there's a pattern to which patients get his personal attention, and which ones get passed down the chain." The resident looked down at his hands. "I wanted to believe it was just about medical complexity or teaching opportunities. But after today, would you be willing to put this in a formal statement?" Detective Wilson asked gently. Dr. Park hesitated, then nodded. "Yes, it's the right thing to do." After the resident left, Detective Wilson added the new information to his growing case file. The picture was becoming clearer, but he knew Dr. Keller would fight these allegations with everything he had. The doctor's reputation, career, and self-image were all at stake. His phone rang. The hospital front desk. "Detective Wilson? There's someone here asking to speak with you. Says it's about Dr. Keller. I'll be right there." In the lobby, an older black woman sat clutching a purse in her lap. She stood as the detective approached. "Are you the FBI man looking into Dr. Keller?" she asked without preamble. "Yes, ma'am." "Detective Wilson." She nodded once, decisive. "My name is Dorothy Taylor. Dr. Keller treated my husband 3 years ago. Or rather, he didn't treat him properly. I've been telling anyone who would listen that something wasn't right about how it all happened. She took a deep breath. I saw on the news that you're investigating him, and I knew I had to come forward. Again. I filed complaints. With the hospital, with the medical board. No one took me seriously. Her eyes held a mixture of pain and determination. But maybe now, with the FBI involved, someone will finally listen. Detective Wilson pulled up a chair beside her. I'm listening, Mrs. Taylor. Tell me everything. As she began her story, the detective knew that the case against Dr. Keller had just taken another significant turn. The walls were closing in on the doctor, brick by brick, story by story. The question now was how he would respond when there was nowhere left to hide. 2 weeks into the investigation, Detective Wilson sat in his hotel room surrounded by case files, witness statements, and medical records. The evidence against Dr. Keller had grown substantial. 16 cases with clear disparities in care, 5 staff members willing to testify about patterns they'd observed, and Mrs. Taylor's heartbreaking account of her husband's treatment. But something was still missing. The detective couldn't put his finger on it, but he sensed there was more to Dr. Keller's story. Something beyond the obvious patterns of discrimination. The doctor was too intelligent, too accomplished to be acting solely on unconscious bias. There had to be more. His phone rang, breaking his concentration. The caller ID showed the hospital's number. Detective Wilson, he answered. Detective, this is Nurse Chen. Her voice was hushed, urgent. You need to come to the hospital right away. Dr. Keller is destroying records. I'll be right there. He grabbed his jacket and badge, heading for the door. 20 minutes later, he strode through the hospital entrance, taking the stairs rather than waiting for the elevator. When he reached the records department, Nurse Chen was waiting, her expression tense. He was here an hour ago, she whispered, glancing around to make sure they weren't overheard. Asked for physical copies of several old patient files. Said he needed them for research. Which patients? That's what caught my attention. They were all from your investigation list. I recognized the names. And he specifically requested the original handwritten surgical notes, not just the digital records. Detective Wilson frowned. Where is he now? His office, I think. But Detective, she hesitated. There's something else you should know. He was acting strange today. Not his usual confident self. Almost scared. The detective thanked her and headed for Dr. Keller's office. He knocked once before opening the door, not waiting for permission to enter. Dr. Keller sat at his desk, a half-empty bottle of scotch beside him. Papers were scattered across the surface, some crumpled, others torn into pieces. The doctor looked up, his eyes slightly unfocused. Detective, he said, his voice weary. Come to make another accusation? Detective Wilson surveyed the scene, taking in the unusual disarray. The normally immaculate office looked like it had been searched or ransacked by its own occupant. I understand you pulled some physical patient records today, he said, keeping his tone neutral. Dr. Keller laughed bitterly. Of course you know that. You have spies everywhere. He gestured vaguely around the hospital. Everyone's so eager to see the great Dr. Keller fall. Where are those records now? The doctor pointed to a small trash can beside his desk, where ashes and charred paper fragments were visible. Gone, turned to dust, just like my career is about to. Detective Wilson stepped forward, examining the trash can. You do realize destroying medical records is a federal offense? Add it to my list of crimes. Dr. Keller poured another drink with an unsteady hand. What's one more charge when you're already planning to crucify me? The detective pulled up a chair, sitting directly across from the doctor. Why don't you tell me what's really going on here? This isn't just about biased treatment decisions, is it? Dr. Keller stared at him for a long moment, then seemed to deflate, the last of his defenses crumbling. You wouldn't understand. Try me. The doctor took a long drink, wincing as the alcohol burned his throat. My father was a surgeon. 3rd generation. Excellence was expected, not praised. Weakness was unforgivable. He looked down at his hands, surgeon's hands, steady even when their owner was falling apart. He had strong opinions about many things, including who deserved the best medical care. And you adopted those opinions? Dr. Keller didn't answer directly. Did you know I was first in my class at medical school? Perfect scores on my boards. I could have gone anywhere, done anything. But I came here because this is where my father practiced, where his father practiced. A family legacy, Detective Wilson said quietly. Yes, a legacy. The doctor's voice turned bitter. A legacy of selective excellence, as my father called it. Save your best work for those who deserve it. And who decides who deserves it? Dr. Keller looked up, his eyes suddenly sharp despite the alcohol. That's the question, isn't it? Who decides? My father had his answer. I thought I had rejected his views, his prejudices. I told myself I was different, better. He laughed again, hollow and pained. But here you are with your charts and your evidence showing me I'm just like him after all. Detective Wilson leaned forward. Dr. Keller, I need to know about those records you destroyed. What were you trying to hide? The doctor was silent for a long moment. Notes, my father's surgical methodology. Techniques he developed for prioritizing care. I kept them as a reminder of what not to become. His voice dropped almost to a whisper. At least that's what I told myself. But you followed them anyway. Not consciously, never consciously. But the patterns, he gestured helplessly. The patterns were there, just as you said. I became what I swore I wouldn't. The detective considered this confession, if that's what it was. Why destroy the records now? Because they were evidence of intent, of knowledge. Dr. Keller looked up, his expression haunted. They showed I knew better, detective. That I'd been warned about these exact patterns in my own family's history and still repeated them. Before Detective Wilson could respond, his phone rang. He glanced at the screen, the hospital's emergency line. Detective Wilson, he answered. The voice on the other end was urgent. Detective, we need Dr. Keller in the OR immediately. There's been a multi-car pileup on the interstate. We have a patient with severe internal bleeding who needs vascular surgery right away. We'll be right there. He hung up and looked at Dr. Keller. They need you in surgery. Major trauma case. The doctor stared at him in disbelief. I'm half drunk and in the middle of confessing to federal crimes. And you want me to operate? They specifically asked for you. Vascular case, critical condition. Dr. Keller shook his head. I can't, not like this. You said it yourself, you're a brilliant surgeon. And right now, someone needs that brilliance to survive. The detective stood. I'll deal with this investigation afterward. Right now, there's a life that needs saving. Something shifted in the doctor's eyes. Purpose replacing self-pity. He stood somewhat unsteadily and moved to his private bathroom. Detective Wilson heard water running, then Dr. Keller emerged, his face wet but his eyes clearer. I'll need coffee. Strong coffee. 10 minutes later, they rushed into the emergency department together. The scene was controlled chaos. Nurses and doctors moving with urgent purpose, trauma patients being assessed and prioritized. Dr. Bryant approached them, his expression grave. Richard, we have a 50-year-old male with a torn aorta. He's crashing. No one else here has your experience with vascular repair. Dr. Keller was already moving toward the trauma bay, his professional instincts overriding everything else. Get an OR ready. Who's the anesthesiologist on call? I want Reynolds if he's available. Detective Wilson followed, watching as the doctor transformed before his eyes, from a broken man confessing his failings to a focused surgeon ready to battle death itself. In the trauma bay, a man lay unconscious, his vital signs unstable, his skin ashen. Dr. Keller didn't hesitate, didn't even seem to register the patient's dark skin as he began his assessment, calling out orders and preparing for immediate surgery. He's going to need blood, a lot of it, Dr. Keller said, his voice clear and commanding now. Type and cross-match. Start 2 large-bore IVs if you haven't already. Where are those scan results? A nurse handed him a tablet showing the CT images. The doctor studied them intently, his focus absolute. Tear extends from the arch to the descending aorta. This is going to be complex. He glanced up, noticing Detective Wilson still standing nearby. Are you coming to observe again, Detective? There was no sarcasm in the question this time, just professional inquiry. If that's all right. Dr. Keller nodded once, then turned back to his team. Let's move. Every minute counts. In the operating room, Detective Wilson watched from a corner as Dr. Keller worked with incredible precision, his hands steady, his commands clear. There was no trace of the alcohol now, just years of training and skill focused on the single goal of saving a life. 4 hours later, the surgery was complete. The patient was stable, his torn aorta repaired through a masterful procedure that had the entire surgical team in awe. As they scrubbed out, Dr. Keller looked exhausted, but clear-eyed. I didn't even think about it, he said quietly. Think about what? Detective Wilson asked who he was, his race, his background. None of it. The doctor stared at his hands under the running water. I just saw the injury, the need. I just did my job. That's all anyone's asking you to do, doctor. For every patient. Dr. Keller turned off the water, drying his hands slowly. I know that. I've always known that, intellectually. But there's knowing and then there's knowing. He met the detective's eyes. My father would have made different choices today. But you didn't. No. The doctor looked through the window to the recovery area, where his patient was being monitored. No, I didn't. They walked in silence to Dr. Keller's office. The mess was still there. The scattered papers, the bottle of scotch, the burned records in the trash can. Evidence of a personal reckoning that had been interrupted but not resolved. Detective Wilson closed the door behind them. We still have to deal with the investigation, with the evidence, with the patients who received substandard care. Dr. Keller nodded, sitting heavily in his chair. I know. And destroying medical records is a serious offense. I know that too. The detective studied him for a moment. But what happens next is partly up to you. How you choose to move forward. Dr. Keller looked up. What are you suggesting? I'm not suggesting anything. I'm saying you have a choice. You can fight these allegations, deny the patterns, destroy more evidence. Or you can acknowledge what happened, make amends, and work to change. Change. The doctor repeated the word as if testing its weight. After all these years? You just proved in that operating room that you're capable of it. Dr. Keller was silent for a long time, staring at the faint traces of ash in the trash can. Finally, he looked up at the detective. What would that look like? Making amends? That's something you would need to figure out. But it would start with honesty. With facing what happened and why. The doctor nodded slowly. I need time to think. To process all of this. Take the night, Detective Wilson said, standing. But no more destroying evidence. No more covering tracks. That path ends now. As he reached the door, Dr. Keller called after him. Detective? He turned back. Thank you for... The doctor seemed to struggle for words. For seeing something in me worth salvaging. Detective Wilson didn't smile, but his expression softened slightly. Everyone deserves a chance to be better than their worst actions. Dr. Keller. Even you. Morning light streamed through the blinds of the hospital conference room as Detective Wilson arranged his files on the long table. Today would be decisive, the culmination of 3 weeks of investigation into Dr. Keller's treatment patterns. The hospital board had called an emergency meeting to address the findings, and everyone involved felt the weight of what was about to unfold. The detective checked his watch. Dr. Keller had requested to speak with him before the meeting, but he was running late. Perhaps he'd changed his mind. Decided to fight rather than face the truth. It wouldn't be surprising. People rarely chose the harder path of accountability when denial remained an option. The door opened and Dr. Keller entered. He looked different somehow, his usual confident stride replaced by a more measured pace, his expression open rather than guarded. He carried a thick folder under his arm. Thank you for meeting me, the doctor said, taking a seat across from the detective. You said you had something to show me? Dr. Keller placed the folder on the table. My complete case records for the past 5 years. Unaltered, unredacted, including cases not in your original investigation. Detective Wilson raised an eyebrow. Why are you giving me this now? Because I spent all night reviewing my own work? Really looking at it pattern by pattern, decision by decision. He tapped the folder. The disparities are even clearer than what you found. I've highlighted them myself. The detective opened the folder, scanning the meticulous notes Dr. Keller had added to his own patient records. The doctor had color-coded treatment decisions, noting alternatives that should have been considered, tests that should have been ordered, follow-ups that should have happened. This is essentially a confession, Detective Wilson said quietly. Yes. Dr. Keller met his gaze steadily. It is. Why? Because you were right. About all of it. The doctor leaned forward, hands clasped on the table. I've been telling myself a story for 20 years. That I rejected my father's views, that I was practicing medicine fairly. But the evidence says otherwise. And the records you destroyed? Dr. Keller winced. A moment of panic, of shame. I've included a statement about what they contained and why I destroyed them. He sighed. I'm not asking for leniency, Detective. I'm just trying to do one right thing in the middle of so many wrong ones. Detective Wilson studied him, looking for signs of manipulation or strategic positioning. He found none, just a man finally facing the truth about himself. "What do you expect to happen now?" the detective asked. "I expect to lose my medical license, to face charges for the records I destroyed, to be sued by patients I harmed." Dr. Keller's voice was calm, resigned. "And I should. Actions have consequences." The detective nodded slowly. "Yes, they do. But intentions matter too. So does what happens next." Before Dr. Keller could respond, the door opened again. Hospital administrators and board members filed in, followed by legal counsel for both the hospital and several patients. Last to enter was Mrs. Taylor, the woman whose husband had received substandard care. She sat at the far end of the table, her back straight, her expression determined. The hospital director called the meeting to order, explaining why they had gathered and asking Detective Wilson to present his findings. The detective stood, but before he could begin, Dr. Keller raised his hand. "If I may," he said, "I'd like to speak first." Surprised murmurs rippled through the room. The director looked to Detective Wilson, who nodded his agreement. Dr. Keller stood facing the group. Gone was the defensive, angry man of previous weeks. In his place stood someone humbled, changed. "For 20 years I've practiced medicine at this hospital," he began. "I've performed thousands of surgeries, treated countless patients, and built a reputation for excellence. But that excellence was selective, conditional, and because of that, it wasn't excellence at all." He looked around the room, meeting each person's gaze directly. "I provided different standards of care based on racial bias, not always consciously but consistently. The evidence is clear and undeniable." He gestured to the folder on the table. "I've reviewed my own records and found the same patterns that Detective Wilson identified. Different decisions for different patients, based not on medical need but on unconscious and sometimes conscious bias." The room was completely silent, everyone stunned by this unexpected confession. "I could offer explanations about my upbringing, about the attitudes I inherited from my father, about the flaws in my medical training, but those aren't excuses. They're context. The responsibility is mine alone." Dr. Keller turned to face Mrs. Taylor directly. "Mrs. Taylor, your husband deserved better care than I provided. He might be alive today if I had treated him according to proper medical standards. No apology can change that, but I want you to know that I recognize the harm I caused. I am deeply, profoundly sorry." Mrs. Taylor's expression remained steady, neither accepting nor rejecting his words. Dr. Keller then addressed the board members. "I've prepared a complete statement admitting to my actions. I'm voluntarily surrendering my hospital privileges, effective immediately. I'll cooperate fully with any investigation, legal proceedings, or patient complaints." The hospital director found his voice. "Dr. Keller, this is unexpected. Perhaps we should discuss this privately with legal counsel present." "No more privacy. No more closed-door discussions." Dr. Keller shook his head. "That's how these patterns persist, through silence and protection. It stops now, at least with me." Detective Wilson watched this transformation with cautious optimism. People could change, he'd seen it happen, but permanent change required more than a moment of clarity. It required ongoing work, accountability, and a fundamental shift in thinking. The meeting continued for hours as the implications of Dr. Keller's confession unfolded. Legal teams discussed settlements for affected patients. The hospital board debated policy changes to prevent similar situations in the future. Detective Wilson presented his evidence, now supplemented by Dr. Keller's own documentation. Through it all, the doctor remained present, answering questions honestly, declining to defend or minimize his actions. When asked why he'd had this change of heart, he glanced briefly at Detective Wilson before responding. "Sometimes, you need someone to hold up a mirror so clear that you can't look away from your own reflection anymore," he said simply. As the meeting finally adjourned, people filed out in subdued groups, processing what they'd witnessed. Mrs. Taylor approached Dr. Keller, standing before him with quiet dignity. "My husband was a good man," she said. "He fixed cars for 40 years. Never turned anyone away, regardless of who they were or where they came from." Dr. Keller nodded, unable to find adequate words. "Your apology doesn't bring him back," she continued, "but acknowledging what happened matters. It matters to me, and it would have mattered to him." "Thank you for being here today," the doctor said softly. "I know it couldn't have been easy." Nothing about this has been easy. She adjusted her purse on her shoulder. Do better, Dr. Keller. Not just for a day or a week. Do better with whatever comes next. After she left, only Dr. Keller and Detective Wilson remained in the conference room. What will you do now? The detective asked. The doctor looked out the window at the hospital grounds below. Face whatever legal consequences come. After that, he shrugged. I don't know. Maybe teach if anyone would have me. Share my story as a warning to others. Find some way to repair at least some of the damage I've done. It won't be easy. It shouldn't be. Dr. Keller turned back to face him. Can I ask you something, Detective? Why did you push so hard on this case? You could have built your evidence quietly, filed your report, and moved on. Instead, you confronted me directly, repeatedly. Why? Detective Wilson considered the question. Because I wasn't just looking for evidence of what you did wrong. I was looking for why, and whether change was possible. And what did you conclude? That's still being determined. The detective gathered his files. But today was a start. 6 months later, Detective Wilson returned to Pine Ridge Memorial. The hospital had implemented new protocols for monitoring treatment outcomes across demographic groups. 3 doctors had undergone disciplinary action for biased care practices. An independent review board now evaluated complaint patterns quarterly. He found Dr. Keller not in the surgical wing, but in a small office in the medical education department. The former surgeon was surrounded by research papers and curriculum materials. Detective, he said, standing to greet his visitor. This is unexpected. I was following up on the changes here. Thought I'd check in on you as well. Dr. Keller gestured to a chair. As you can see, my circumstances have changed considerably. The hospital kept you on staff? As a consultant only. I don't treat patients anymore. He pointed to the materials on his desk. I'm developing a curriculum on bias in medical decision-making, using my own case as the primary example. Detective Wilson nodded, noting the absence of the expensive artwork and awards that had decorated the doctor's former office. How's that going? It's humbling, necessary. Dr. Keller leaned back in his chair. I lost my medical license for 6 months. It's been reinstated with strict supervision requirements, but I've chosen not to return to practice. Some of the patient lawsuits are still ongoing. And yet you seem at peace? The doctor smiled faintly. Not exactly, but clearer, more honest with myself. It's a beginning. He pulled a folder from his desk drawer. I've been tracking my former patients, the ones who received substandard care, making sure they're connected with excellent doctors now, covering their medical expenses when I can. It doesn't undo the past, but it matters, Detective Wilson finished for him. Yes, it matters. Dr. Keller studied the detective. You know, I resented you deeply at first. Hated you, if I'm being honest. I'm familiar with the feeling. It comes with the job. But now I understand that you saw something in me that I couldn't see in myself, both the flaws and the potential to address them. The doctor extended his hand. Thank you for that. Detective Wilson accepted the handshake. Don't thank me yet, Dr. Keller. The real test isn't what happens in moments of crisis or revelation. It's what you do every day afterward when no one's watching. I know, but for the first time in my life, I'm watching myself. Dr. Keller's expression was solemn but hopeful, and so are a lot of other people now. That's how change happens, through accountability, through community, through refusing to look away from uncomfortable truths. As Detective Wilson left the hospital that day, he reflected on the case that had begun with clear evidence of wrongdoing and ended with something more complex. Not redemption exactly, but the messy, ongoing work of genuine change. The world had enough perfect villains and perfect heroes. The real story was in the difficult middle ground, where flawed people confronted hard truths and made choices about who they wanted to become. It wasn't a fairy tale ending. It was something better. It was real.